I'm honored to be part of this great fall meeting, and a special thanks to Professor Wu and the organizers for giving me this opportunity. I'm sorry I could not be there physically, unfortunately due to some visa issues, but I'm happy to give this talk virtually. So our next, hopefully 10 to 15 minutes, I'm going to talk about a very important topic. It's the CTO toolkit for success. All of us are nowadays interested in doing the CTOs, but it's important to learn the basics. So that's what I'm going to cover in this talk. And I'm sure there are other CTO talks which are going to talk in more detail. So basically, for a successful CTO PCI, there are certain requisites, and we definitely need to have proper tools for which I'm going to talk in next few minutes. And this special kind of a skill set and experience is also very important. And obviously, a well thought out strategy that includes appropriate patient selection is also very, very important for a successful CTO PCI. So, in terms of basics, if we want to divide, I think every CTO PCI can be divided into three phases. Number one, obviously, the most important one is crossing the CTO, whether it is anti-grade or retrograde. Then vessel preparation is very important. And obviously, lastly, the definitive treatment in the form of either DCB or desk placement. So, in terms of strategy, really is the one that determines the choice of different tools which you use during CTO. So let's talk about the tools for crossing. Obviously, wires are very important, microcatheters, and sometimes you may require re-entry devices as well. Similarly, for vessel prep, the tools required are balloons, atherectomy devices, or now everyone is talking about intravascular lithotripsy in special cases. Similarly, the definitive therapy basically is drug-coated balloons or stents, and there are some adjunctive tools which can be sometimes very important during CTO PCI, and that includes basically imaging or any other support devices that are required off and on. So let's discuss what are the important wires which you can use during CTO PCI. So wire selection really depends on the strategy or the technique you are planning to use during the CTO PCI. And these wires are often used to perform specific functions during CTO PCI. You may require a special wire for cap penetration and may require a different wire for tracking within the plaque and or the extra plaque space. If you are doing retrograde, then septal or epicardial surfing or crossing may require different wires. Sometimes you may have to do knuckle. For that, you may require a different wire. And obviously, for re-entry, sometimes you need wires which are like really have very stiff or heavy tips. And sometimes you may interchange these different wires one from other during the procedure. So when we talk about the wires, the important properties for the wires, all of you, I'm sure, are familiar with. Our torqueability is important, which is the ability of the shaft to overcome the turning resistance during crossing. Trackability, again, is very important. That's the ability to deliver the wire along the vessel and the stenosis. And tip load, again, which helps in penetrating the cap. That could be important, and that's basically the amount of force it takes to buckle the tip. So wire support becomes important. That is basically the thickness of the core material which is used, and obviously the tactile feedback also gives you a very important information, and that's basically the response the operator feels while maneuvering that particular wire. So when we talk again about wires, what makes a CTO wire special? You need to remember three C's. One is the core material of the wire, then the coil at the tip of the wire, and obviously the coating on the tip of the wire as well as rest of the wire. That also becomes important in certain situations. So all these things really are important in different CTOs, and you have to basically need to know all the details about all the different wires, about the core, coil, and coating to use that particular wire during the CTO. So whenever actually you get a wire or see a wire, and all these things are really mentioned in the brochures of all the wires. These are some of the wires from like Asahi, Gladius, Mongo. Again, it gives you the tip load, core material, and all those things are mentioned in those brochures, and Fielder XT, and similarly Asahi, Gaia, or other wires, whatever wire you use, they have all these things mentioned over there. And you should at least remember few of those important characteristics of these wires. And again, you have to really make a special bends in these wires to really penetrate or cross that CTO. And usually you want to make a very small or a kind of a short bend around 45 degrees to start. And then again, depending on what other tools you're using, you can modify accordingly. So the wires, I would say for CTO PCI, my selection basically, and these are the most common selection about CTO operators, may have their own specific wires they use. Some of these wires I just like to use or have experience with, so I'm going to give you that. If you need to, if in a CTO you do see small micro channels and you need to probe and cross those micro channels, then you can start with Fielder XT, or the alternative you can use Xeon Black. Similarly, for cap penetration, you need a like heavy tip load wire, and Gaia second and Gaia third could be the starting wire. And if that doesn't work, then you can go to CP12 or Hornet wire that again has a higher tip loads. Similarly, if you want to cross the intra-plaque navigation, the first choice you can use Gaia 2 or Gladius Mongo can be used also. Extra plaque navigation also, Gladius Mongo, which is one of the relatively newer wires, is a good wire. And alternatively, you can use Fielder XT. For knuckling again, Gladius Mongo is good wire, or you can alternatively use Fielder XT or Pilot 200. And septal surfing during retrograde PCI, CTO PCI, you can start with Scion Black or just plain Scion. And similarly, for epicardial crossing or for again retrograde CTO PCI, you can start with this one of the new very good wires, SUO wire, or alternatively, you can try Fielder XT as well. And for again re-entry, when you want to like you go maybe under the plaque and you during the CTO segment, and then you want to re-enter into the lumen, you may need a heavy tip wire to really penetrate the intim and enter into the lumen. And for that, you can use CP12 or Hornet, or nowadays you can try even the heavier wire, which is S-Tato as well. So these are the few of the wires. And again, you have to use these wires and get used to it and get experience, and then may become one of these favorite, or you can try other wires which are like every day you come up with the newer wires from different companies, they can be used as well. So the next tool, which is again very important in CTO PCI, is microcatheters. And these are really the essential for CTO PCI success. There are different brands that are available. There are several advantages. Now, people used to use over-the-wire balloons before, kind of as microcatheters to get the support to cross those CTOs with the CTO wires. But there are definitely advantages of using microcatheters as compared to over-the-wire balloons. These microcatheters has greater flexibility. They are easily torqueable and can be used several times. You can go back and forth or use in different arteries as well, coronaries as well. So in order to use a microcatheter, you really need a good guide support to really get the optimal engagement of the microcatheter into or near the CTO. Again, this can be the microcatheter is going to be very helpful. It has several uses. You can do the wire exchanges through that. You can give contrast or medications distally through these microcatheters. And these microcatheters, again, sometimes can be used for channel dilatation as well. When you want to enter your balloon vein or cross, and if you torque these catheters, you may be able to get through, and that is going to dilate these channels and could be helpful for further success of the CTO. There are specialized microcatheters available as well. They have an angle tip microcatheters. Similarly, there are dual lumen catheters when you have to cross to the branch. and these could be very low profile microcatheters as well. These are few of the different types like Turnpike LP, Turnpike Spiral, or Turnpike Gold, and there are different multiple other microcatheters available, have different properties, and again you start using it and get comfortable with it. But it is important to use one in CTOs to really succeed in doing that PCI. These microcatheters has different layers. They have a PTFE liner, and then there is a braided steel in and dual coil bidirectionally, and also there is a polymer coating. And all these basically coatings are helpful to really navigate those coronaries or cross the CTO segment and help you to get the wire and the balloon through to make this CTO successful. Now, how to get the most out of your microcatheter? Basically, as I mentioned before, also you need a good guide support really to get the microcatheter to the location where you want. Similarly, you need to ensure that wire is advanced as far down as possible to get the maximum support to push the microcatheter down. This works best when you actually get this microcatheter over the stiffer part of the wire. You can alternately clockwise or anti-clockwise rotate these microcatheters in both the directions. But remember, do not over torque the catheter more than like 360-degree turns, rotations. If the distal tip is not rotating, then stop there. If you are going to do over torque, you can end up causing catheter fatigue, or sometimes it may break if you keep rotating in one particular direction. So you have to do alternatively clockwise and anti-clockwise, and not too much in one direction. That is a very, very important tip to remember. So the dual lumen microcatheters also could be very helpful and useful, especially when you are need to really enter to the side branches. And you can put basically two wires, one in the central lumen and one to the side. And these are some of the basically applications of dual lumen microcatheters. You can, like, if you look at on the top, number one, there is subintimal anchor technique. You can do that. Similarly, reverse wire technique, side branch access through the stent struts, access to side branch occlusion, side branch wiring could be helpful, retrograde tip injection and access, selective injections you can do from that, protection of the side branch by putting a wire in there, retrograde anchor technique and side branch anchor technique. So these dual lumen microcatheters could be very useful in these different situations, and could really make the difference between a successful or unsuccessful angioplasty. So these are the angled microcatheters, and there are different angles, 90 degrees, more than like acute or obtuse angles, which helps help you to get into a particular side branch or direct your wires in a particular direction. And these could be very useful as well. Now, other very important tool for a successful CTO is a guide extenders. And these guide extenders really help to overcome the issues of poor guide support. Sometimes when your guide support is not enough to even push the balloon or stent down, or the artery is very tortuous, especially in case of right coronary arteries. In those cases, you can use these guide extenders, and they are very, very useful to get the balloons or stents down where you want it to be. There are several brands available. There comes in various sizes from 5 French to 8 French. And these could be deep seated to allow the movement of stents distally where you want to get the stent to. And similarly for other devices like balloons as well, especially if the anatomy is very unfavorable or very tortuous, or sometimes it's calcified, you may not be able to wire bias is there and you're not able to get your balloon or a stent down. In that case, this could be very helpful. There are several novel uses of these guide extenders. They can assist in the reverse cart, isolation of the extra plaque space during antegrade dissection re-entry. These guide extenders could be helpful as well. So this is what the guide extender basically looks like. It has a radio opaque marker at the distal end, and there is another radio opaque marker where this wire comes out from this, and your balloon or stent enters over there. This is the guide liner reverse cart. Sometimes it could be helpful. Basically, if you get this is the right coronary artery, and you can put the guide liner down into the right coronary artery. Like over here, you can see where the arrow is, and the reverse cart. During that, your wire and microcatheter, you can just put it into this guide liner and basically take it out. So that can be used during reverse cart as well, other than just getting your balloon or stents down into the tortuous or difficult anatomy in the coronaries. The trapping devices can also be sometimes helpful, although you can use a regular balloon to trap the wire into the guide. But there are like these special trapping balloons also that can be used basically, and that helps you to basically externalize the wire or to take out the balloons or the equipment on a shorter length wires. So you can use a regular balloon or these trapping devices to basically trap the wires or other devices. Now, re-entry devices sometimes could also be helpful. There are different types of re-entry devices. This is stingray balloon can be used, and similarly, this anterior re-entry device can also be helpful when you have crossed subintimally in the CTO segment, and then you want to enter into the true lumen in the distal to the CTO. You can use these devices, and they could be very helpful in such cases. There's one of the newer re-entry devices called Triumph catheter. It's a unique design. It has like around 6 wire exit ports for precise wire advancement and clear visualization. It's a multi-layered shaft, provides impressive, very flexible, and a very good tracking capability. And basically, it goes over the 0.014-inch guide wire in very complex coronary interventions. Imaging tools again are very important in CTO. This could include IVUS or OCT. Imaging allows identification of the proximal cap. It helps the operator understand the anatomy and composition of the occlusion. It also helps with vessel sizing and optimal stent deployment. These are some of the examples. The newer imaging techniques, if you look on the left side, there's a Corsair catheter, and the second wire is there, and the IVUS transducer is down there, and that helps you to tell you exactly where that wire you can basically help to cross that segment, and that could be very helpful. Or if you have to enter a side branch, and you can keep there's a side branch coming off at the CTO side, you can keep the IVUS device in the side branch, and that helps you to direct your wire to enter into the main lumen. So imaging tools could be very helpful during CTO PCI as well. Snares again are very important. You need to know and remember these. These are the 2 different types of snares, end snare and one snare. They comes in different sizes. They are basically especially helpful in retrograde PCIs in order to grab the retrograde wire and externalize that wire. That could be very helpful in that. So you need to know these snares if you are doing retrograde PCIs. And it also is helpful sometime in complications to tackle those complications, or basically any embolized devices. You may have to really take that out with the help of snares. So you need to understand and know how to use these snares if you're doing CTO PCI. You should be also familiar with the tools for managing the complications. Pericardial centesis kit should be there all the time. The vascular occlusion devices in case of perforations, distal wire perforations, coils or gel foam. You should be familiar with that so that you are able to take care of that if that happens. Obviously, covered stents could be a lifesaver, especially if a significant perforation occurs. Different type of covered stents are available. This is the old Joe stent Graftmaster. However, now it's a much better profile covered stent by the name of PK Papyrus, which is available, and it is a single stent design and has a much lower profile. If you look at the Graftmasters profile versus PK papyrus profile is much better and can be easily taken down to the place where there is a perforation. So you should be familiar and you should have that in your lab as well all the time. So different tools can be used during the PCI, and this is one of them. I could not actually play this, but it has the snare, trying to snare the wires, and basically microcatheter as well as guide extenders, and all these things are being used to basically do the RCA CTO, and finally it was really successful. So I think lastly, I would say that every lab, it's easier and much better to have a CTO cart, so that all those CTO things which are required, all those tools to make the CTO successful or to tackle any complications should be in one cart, so that everyone in the cath lab is familiar way to get those things when you're performing a CTO, and easily accessible, and you know what is there and what is required, and you can take it out easily and basically take care of that CTO PCI. So in conclusion, the CTO toolkit really has grown exponentially over the past couple of decades. There are now several choices available in each category of the toolkit, and the CTO operator should commit to becoming experienced with at least one or two devices in each category, whether those are wires or microcatheters or guide extenders, and all those things. They should be familiar with it and have the experience of using it. Several options. There are several options available for learning. You can go to online tutorials, proctorships, formal training programs, and again, I think the most important thing is you start, once you learn it, you start practicing so that you become expert and familiarized with everything. It's important to have tools to manage the complications, because the complications are going to occur if you're going to do enough procedure. So you should be well equipped and well versed to handle those complications, and you should also have the personnel who know how to use all those tools. A mobile CTO card can help keep the lab organized and help with the workflow, so which is very important. With that, I would like to end and thank you once again for your attention and giving me this opportunity. Thank you.